Hey everyone, welcome to another session of Conversations with Courageous Cancer Warriors. And today I got to tell you, we have an amazing guest. We have Dr. Aimee Duffy, who has an amazing book that she has out. We're going to be talking about retreats. And if you want to learn more about her, she's been on every single platform from the Harvard Club of Boston to really CNN, right? This woman is a powerhouse and we are so excited to have her here. Aimee, thank you so much for being here.
Absolutely. Enjoy it. Thanks for having me.
So tell me a little bit about, so you're a physician. So tell me a little bit about that.
Yeah, I'm a medical doctor, family practice by trade. And, a lot of people say, well, how did you get into this whole, we call functional or integrative medicine? And it goes way back to when I was little. I absolutely loved babies. Babies was all I wanted to think about and play with babies. And so I did a lot of babysitting in my childhood. My first job was 11 years old as a babysitter. And when I was 17, I was a senior in high school, and one of the families that I was had got really close with asked me, or invited me, I guess, to be in the delivery room when they were having another baby. So this is an amazing experience. I don't think even then, we never really seen anything on TV or movies. I had no real expectation of what was going to happen. So I was just super excited. And that experience, as the process went on, and just for lack of time, I could go into 20 minutes of telling that story about the delivery itself. But baby Joshua was born, put on mom's chest, and I was just like, this is the coolest thing I've ever seen. Like, I want to do this. I'm going to be a doctor. I don't want to be a pediatrician anymore. I want to deliver babies. So that was kind of this, changing experience for me. So went to college, went to medical school, thought I was going to do OBGYN, but they didn't seem very happy in the residency that I was in, or the medical school. Sorry. I don't know. They just seem overworked, overtired, kind of the classic, what you would think about residency from movies and TV shows like Grey's Anatomy, stuff like that. And then I did a family practice rotation, and they were like, it was like rainbows and flowers. I don't want to put that down, because it really was serious, and we do learn a lot and hard work, but they had a schedule. Half of them were pregnant in their residency. So it's all about family oriented. I had a baby in medical school already. So I was already a mom at that point, and knew that I needed something that was going to be fitting with what my family life was going to be. So I chose family practice, but I knew that I loved the idea of delivering babies, and there still in this world are family physicians who deliver babies. So I chose a residency program that was heavy in obstetrics in a rural South Carolina town here in Seneca, South Carolina. And so delivered babies. And lucky for me, about a year after I graduated from my residency, one of the local OBGYN groups offered me a position to be a partner in their group. So I jumped right into not only delivering more babies, but this whole women's health thing that I got 2 weeks of training in residency. So this was like 15 years ago. So this is around the time when Women's Health Initiative was a big deal. And we were talking about the dangers of hormone replacement. And I had all these women who were either on hormones or needed hormones. And, we were talking about, should I come off of them? I don't want to start them. I'm scared, this whole conversation. And I was a little bit like, I don't like the numbers either. I'm not sure that I want to prescribe something that we're seeing is, women are dying after being on these medications. That was particularly like Premarin and Prempro. So I started researching and digging in a little bit more, and happened upon this whole idea of bioidentical hormones. Never had heard of that in my entire medical training or career. And I ended up at a conference with some other physicians on natural hormone balancing and bioidentical hormones. And it was like Alice in Wonderland, going through this little tiny, hole into this like rainforest of amazingness. And I'm like, how did we not know that this existed? Why didn't anybody tell us this? And so that's really what prompted me to start looking at alternatives to what I had been trained in terms of what are the hormone imbalances, what are the deficiencies. If we just, replace that with bioidentical hormones that get us back to normal, then, we feel good and we don't have to worry about these big side effects. So that's really where my book normal doesn't have side effects come from, is that if we can just get people back to normal, we're not dealing with the conversation about what are the bad things that can happen if I take this medication. So it all started with hormones and delivering babies, and then has just progressed, because you can take that theory and put it to, gut health, brain health, heart health, everything, mental health, what's out of balance. Do you really have depression, or do you have a hormone imbalance? Do you have, nutritional deficiencies? Is your gut a mess on the inside that's, creating this, gut brain barrier dysfunction that can cause a lot of symptoms there? So that's really where this whole process started. And now, I do what I do, and it's awesome.
And we are so fortunate. So first and foremost, guys, if you don't know what residency life is like, it is hard. I trained residents my entire career, and I have to tell you, they were so grateful for the PAs because we tried to lessen the burden for them. So I commend you first and foremost for being like open after seeing someone giving birth at such a young age that sometimes can be traumatizing for people, and they end up on the floor, right? It's kind of like autopsy. You don't want to kind of see it. But I absolutely love where your journey brought you. And you have just in the small introduction have said so many powerful things. And I can't agree with you more that, if we can have a natural modality to make people feel better, it's definitely the way we want to go. I know for myself, from my experience through breast cancer, they put me on tamoxifen, and it was like probably the worst thing that I could have gone through. How, in your opinion, how can patients advocate for themselves when, I hate to say it this way, but sometimes people are kind of like, here, take this and just go and deal with the side effects and you're fine. Yeah. What can they do for themselves?
And I agree. I mean, that's a scary place, because especially when you're dealing with, something as, I want to say acute as cancer, it's not always acute, but it's different than, oh, you have high cholesterol, it's not, that's not as scary, even though it could end in the same results. Like, you get this cancer diagnosis and it's very scary. And, you're looking at this provider who is supposed to be an expert in their field, and they're telling you, this is what you need to do to not die. So it really is a tough place for patients to be, because you don't know, and you want to trust that person. But even, then it's like, okay, well, you're giving me this stuff that feels like it's poison, and, I don't feel good. And is this really what I have to do or not? And so, and it's hard because the internet is full of information, right? And it's really hard to trust, in that situation. I'm going to Google alternative treatments to breast cancer, and you're like, can I really trust this? What's going on? So it's not so much looking for alternative ways to treat cancer. And what I tell patients all the time that come to me, they don't come to me to treat their cancer. I don't do that. I'm not an oncologist. I'm not a cancer doctor. But what I'll tell you is that cancer is an insult to your body. It's an inflammatory response. And our goal is not really to treat the cancer, but our goal is to help your body to manage it the best way that it can. And that's not only while you're going through an acute treatment, but the long term, obviously, is to be, be in remission, but that it's not going to come back either. So what are the things that we need to do differently in your life so that, one, you can fight it now and survive through the chemo and treatments and all that kind of stuff, and then also be confident that you're doing everything that we possibly know we can do to keep it from coming back later. So we do a lot of work in what's our diet, what's our, what are deficiencies. We know that vitamin D deficiency can lead to cancer, or exacerbate the process, that kind of stuff. So there are things that we can do to test and see where you are. We can heal your gut. We can work on your immune system, and we can help support you from that mental health perspective, which is a lot of what that stress is about. Is, I'm going through a tough time. I'm already taking medication. I don't know that I'm depressed. Do I need an antidepressant? I don't really want to go down that road, but what are some things that, we could support with, supplementation or things like that. And I think when you have some support from that perspective, and also some control, okay, I can't control the medications these doctors are taking me or what my response is going to be, but I can control what I eat. I can control how I move my body and try to detox a little bit. I can control the things I'm telling my brain. So, there's a lot of work in just, these positive mindset mantras kind of thing, like I am healthy. I am strong. I can beat this, that kind of stuff that you go through. So that's really where I say our approach is, and there is research there. So you're not Googling, how do I fight breast cancer, but you're Googling, how do I reduce inflammation in my body? How do I, find out what things might be causing stress on my system? How do I find a doctor like that, that can help support me, or a coach or somebody that's going to give you some guidance outside of just what you're reading on the internet.
Yeah, and that's so valuable. That's such valuable information. And, I can't agree with you more about, we can only control what we can control, right? So a lot of us are in this spot where we have to take these medications, but it doesn't mean they have to be the end all be all. Right. There are also the alternatives that you can do, if Reiki, meditation, yoga is for me is a form of meditation and movement. It's amazing, right? And then you could do, some people believe in ozone, and you could do infrared therapy and hyperbaric chambers, right? There's the list goes on and on.
We do high dose vitamin C here in my office, and there's a lot of research on that. And again, I'm not telling the patients, don't get your chemo and come here instead. I can cure you, but let's do this together. And oftentimes, if we find the right oncologist, they're often happy and willing to collaborate, and that, they can go get their chemo, and in between, if they're doing chemo every 3 or 4 weeks or whatever, they'll come here and get IV therapy. And of course, I try to convince them, or convince is not the right word, add in, let's work on your diet, let's work on other supplements that could be helpful at the same time. So absolutely, there are so many different modalities. My massage therapist that I go to, actually is a breast cancer survivor as well. And she's in her late 40s, I think. So she told me her story was that when she was going through her treatments, the only thing that made her feel better was getting her weekly massage. Mm-hmm. And so as she kind of came through and started feeling better, and cancer was gone, she realized, hey, what do I want to do with my life? And I want to help people feel the way that I felt and go through that process. So she went and got her massage certification and training, and is now a massage therapist, with the goal of helping people feel the way that she did while she was going through her treatment. So I think
and that's exactly why I became a coach, right? Yeah. So I left the PA world in order to go and help people, because I'm like, if I was overwhelmed and I had the medical background, then how did anybody else get through it? So exactly. You said something that was really great. Well, you said a lot of things that were really great. The one thing that I really love is that gut connection. It is so important, and make sure, a lot of people believe that your illnesses stem from the gut. What's your opinion on that?
Oh, absolutely. And I can't say there's a direct connection between, cancer and gut issues, but we are seeing, and it used to be a term that was sort of a woohoo, this is weird alternative medicine, but there's so many studies and data now on the whole leaky gut thing. And, where is that coming from? And people like, why are we always talking about gluten, and, why does everything have to be gluten-free? We didn't have that when we were young. Where is this all coming from? Is this just a fad in the healthcare, world or whatever? And I think, we can go way back when our lives have changed, our food has changed, everything has changed, and we're just exposed to this mess. And, again, what can you control is, trying to eat the foods that are not, messed with as much. So the non-GMO, the, organic, as many, what I say is try to eat the food in as little steps as possible from where it came from to how it gets in your mouth, right? So an apple, you pick off the tree and you eat it, hopefully organic, so you don't have to be washing it from, all the chemicals. But we go eat wheat or gluten, we go eat a piece of bread or whatever. Like, we didn't go just pick the wheat out of the field and chew on it. And then we don't go just take spoonfuls of flour and eat it. So there's a lot of steps that have to go on to create this piece of bread. And some of those steps, have a lot of chemicals, or it's changing the food from where it came from. And so I think our exposure to chemicals, exposure to things like that over time is just, I think about it like just a little fine piece of sandpaper just irritating the desk, what I mean, that we got on our pieces of wood, we have all kinds of layers of protection on top of this wood to protect it. And that's what our gut does. It has 5-6 different layers of protection. But as those things start to get eroded away, like we live in this world now, I mean, we've always had antibacterial soap and stuff, but with COVID now everything's antibacterial. But that's killing our good bacteria, right? And then we got antibiotics on top of that. And some people take probiotics, but they don't really know whether it helps or not. And so, I mean, that's just, one layer. And then we just have damage after damage after damage of these layers. And that creates a lot of inflammation. And basically it opens up that space. Your gut is like your skin on the inside, right? So if you had, you have good protection here, but if you start to have layer after layer removed, it doesn't do its job. You get infections,
Right.
you get swelling, it gets red, irritated, and it creates, more inflammation elsewhere. So, the gut is just it's when it becomes inflamed and irritated and open, now all these chemicals and bacteria go right into your bloodstream, go right into your brain, go right into, cells that were otherwise protected. And so your body's job is to keep you alive. And it's going to send a whole lot of signals to wherever this place is to say, these are bad things. And then it gets confused because it's trying to fight this huge war. And so it just starts attacking everything.
Yeah.
And, that's
Hence,
autoimmune, but
autoimmune,
cancer,
exactly.
Cancer is really a very similar process.
Yeah.
Maybe there's some genetics connected, but that's where the stem comes from.
And somebody had told me once, and it stuck with me, and what you were just saying about our foods and like ensuring that you get it as pure as you possibly can, right? Like the apple off the tree, or like the wheat, chomping on the wheat, right?
Right.
So they once said to me, if you stay on the periphery of the grocery store, you have a much better chance of getting whole foods. And absolutely. I can't agree with that more. Like one of the first things that we can do is really stay away from the packaged food as much as we can.
Yeah.
Would you agree with that?
Oh, 110%. I mean, again, what did it take to get that food into a package,
Right.
I can't think of anything really except maybe coconut oil or olive oil that's in the middle of the, in the middle that is okay, to get from there. But, what do you want? We need to eat our vegetables, and we need to eat some form of protein. Fruit even, is okay. And I'm not saying no fruit, but, if we're trying to minimize sugar, which feeds any kind of inflammatory response, then, fruit's not our friend either. So there are some super fruits like your blueberries and stuff like that we can certainly do. But for the most part, it's get your veggies and pick your protein and really kind of stay on the right side of the grocery store for the most part. I mean, every single store is usually built the same, where the produce is on the right and everything else, goes from there. So
yeah, that's a great
absolutely.
tip.
And the more you can do local, at this time of year is a great time for farmers markets and things like that. So, everybody says, well, we can't always guarantee that those are organic, but I'm like, well, I'm pretty sure people growing stuff in their backyard are not going to be spraying it with all kinds of horrible things. You can ask about it, but they're not going to label it organic because they don't want to go through the process of having that certification, but, it's probably going to be a better source of nutrition for you than anything you can get in the store.
Yeah, that's such great advice. Such great advice. So now talk to me a little bit about this book that you have. So it's called Normal Doesn't Have Side Effects. So you touched on it a little bit.
What I was saying is, a lot of times I'm having conversations with my patients about what we're recommending, whether it's a supplement or whether, it really stems towards more the hormone imbalances and hormone therapies. So when I'm suggesting, hey, I think, maybe you need a compound hormone cream that has a mixture of some estrogens, progesterones, I said, and when you start to use this, because you can see on your testing that your progesterone's low, your estrogen's low, and we're going to, my goal is to bring these levels back to normal. We're not going to some crazy, testosterone of 800 when it just needs to be 30 and you're 12, there's, a slight amount of improvement there, but it's going to make a big difference in your symptoms. So, as doctors or providers, we were taught in medical school, I'm going to prescribe this medicine for you. And here is all the things that you need to be looking for that could happen if you take it, right? So you probably got that with tamoxifen
Yeah.
is, okay, I'm going to give you this list and you're going to feel horrible. You're going to have joint pain. You might be fatigued, headaches, all this stuff. So how does that make you feel? One, you're like, well, I don't really want to take this, but now you're scared, you're worried. And not that I never have anybody complain about a side effect with what I'm doing, but what I say is that, my goal is to get you back to normal, and normal doesn't have side effects. So I don't have a long list of things for you to expect outside of I feel better. So if something doesn't feel normal, then you call me and you say, okay, I've been on my hormone cream for, 2 weeks or a month, and this is what I'm experiencing. Is that common? Is that something that's expected? But I'm not going to hand you this list of side effects to look for or worry about. There's nothing I'm going to give you that is dangerous, because again, this is the exact same chemicals that should be in your body that aren't there. So there's no downside. There's no call me if this happens kind of thing. So I've said that for years when I'm talking to my patients about this. And so I always say, I say that quote so many times that it needs to be the title of a book. And so I really wrote the book based on the title and said, okay, what does that mean? And how does this go into what do I do? And so my book is basically a compilation of what I call the pillars of health. So we're addressing the gut, we're addressing nutrition, we're addressing hormone imbalances, we're addressing toxins and exposure to toxins, and our stress management, mindset. And then of course we have to move our body. So exercise is part of that as well, and that we work hard. And it's hard work to be healthy. You don't see healthy people just sitting around doing nothing, right? Like healthy people are cooking their own food, and healthy people are exercising every day. And so, it's not about what can I do to make it easy? It's just about how can I make it easier and make this part of my life. So it's a combination of that, but I really wanted to write a bit. It took me about 5 years of thinking about this book before I actually put it into paper, because I didn't want it to be just another book about how to be healthy. Not that there's a lot of books out there, but there are. And, I read a lot of books from my colleagues and things. So I'm like, I don't want it to be the same book that they wrote. I want it to be my book and something that's different. So there's some information in there, of course, that is connected and similar, but I then started to add in my own stories. And so you'll start to see some personal connection with having a baby in medical school and delivering my own baby, which is a fun story, baby number 4. And some stressors that I've been through, because, we're all human. And I think that allows people to relate to me as a person. So it's not so scary. I try to live my best life, but it's not always perfect either. So, as you start to share these stories, one, it was therapy for me, because some of these stories are not things that you want to share, about going through a divorce and super stressful times. So, it was therapeutic for me to get some of that stuff out there. And then, you can talk about it, and it doesn't, it's not your cancer, it's not hanging around in there, bottling up. So that's kind of where this book came from. And it's pretty fun. And I have, now that I've written the first one, the ideas are just, floating for
You've
book
opened the
number 2,
floodgates.
and then book number 3, I want to write a book specifically about breast cancer and hormones and the connection there. So that's
and we need
somewhere.
We need you to do that, because I think it's one of those things that people don't understand what that means. And right now I'm going through ovarian suppression. And it's one of the most difficult things I've ever gone through. It's worse than going through a bilateral mastectomy and doing all of that. This is probably the hardest thing I've ever had to do. And nobody can prepare you for that.
Yeah.
All the things that are going to happen. Like I was making it a joke the other day, because, we live in a high-rise building. So I need to go in the elevator down to the main street to bring our Frenchies out. And every day, every time I go out that door, I have a different outfit on. And people must think like, what is this girl up to? not realizing that I'm literally sweating through my clothes, that I need to keep changing. And I'm like mismatched. I like, my fashion sense to people in my neighborhood are like, what is up with this girl? Because it's absolutely terrible. Nothing goes together, because I start out cute and then it just goes downhill.
Yeah.
But I mean, it's stuff that you don't prepare for. And also, you know, one of the conversations that I didn't expect when I got diagnosed is, what do you want to do with your eggs? Do you want kids? Do you not want children? Like, how does that work? And I think we never really think about it.
Yeah.
We don't think about what, you know, if I knew that when I was in my 20s, I probably would have gotten my eggs harvested, you know, but not that. So it's kind of like a lot of unknowns come up. And so that's why we need people like you to bring forth this knowledge in a fun way.
You know, some more knowledge to, like you said, I mean, you know, a lot of that stuff feels out of your control and you're just trying to deal with it, survive through it. And so, you know, how can we bring back to what can I control?
Yeah.
You know,
you better believe I'm controlling the fan now that I never wanted to have. It's made its way towards me and I'm like, don't you touch it. And it's on like high blast, when I used to be like, turn that thing off.
Yeah.
So one of the other things that you have going on that is absolutely amazing is a retreat. Would you like to give us a little bit of information on that?
I would love to. So I have spent some time my own self doing work related. So actually, when I wrote my book, I went to this villa in Mexico. It's a house. It's a personal house that my mentor, who actually helped me get into this podcast world and do some things on TV and whatnot. And he was having an event there, and I was talking to him, and I said, I really want to get this book done. And he said, well, just come hang out, you know, in Mexico for the week. And not all of us can do that, but you know, I was like, I'm not going to get this book done on, you know, my Thursday afternoon admin time at work. You know, it's not, that's just not going to happen. And I have 4 kids. So weekends are spent, you know, being mom and traveling around with their softball and basketball tournaments and all kinds of stuff. So I really felt like if I was going to get this book done, I need to go away and do it in a place that is, you know, a good environment for me. So I went to this retreat or this villa. And while I was there, I started thinking, well, if I'm experiencing this, and this is a place where I can not only have relaxation, but I can be productive. And one of the best things is that there's this chef there, and they can make any type of food that you require in terms of, does it need to be gluten-free, dairy-free, tomato-free, or onion-free, or whatever your, you know, your personal dietary benefits or issues are. And they make it amazing and they taste good. And so it is really just, what's your vegetable and what's your protein today? You know, there's very little carbs, there's no sugar, there's no bread there. it's already gluten-free to begin with. So you can go to this place and have this amazing food prepared for you that is healthy. We have not shakes, but juices. We have celery juice, which is super anti-inflammatory. We have this watermelon elixir made with ginger and turmeric, which is like an anti-cancer shot in and of itself. So, I mean, there's just this benefit. And then there's this gorgeous view. So it just brings you into this serenity. So I decided I need a place where I can bring my patients or people who aren't my patient yet to learn. So we're going to sit around the table and have this kind of conversation. But at the same time, you're in this beautiful environment. It's a private house, so it's not a hotel where you're busy with other people in this conference and, you know, that kind of stuff. So we're going to have yoga, we're going to have meditation, we're going to have workouts. We can play tennis. If you're a tennis person, we can, you know, do some little hikes, and it's just a fabulous place to be. So I'm doing this health and wellness retreat in September. It's the end of September, the 26th through October 2nd. And you can go to my website, aimeeduffymd.com, or my office website is carolinaintegrativemedicine.com, and you'll have the links for that to share as well. And I'll try to give you and share a direct link to the website for the retreat if that's something that piques interest of your listeners. What a great place to learn about some of these things we've talked about. How can I be healthy? How can I, you know, incorporate some of these anti-cancer foods and supplements and take some of that back. So every time I go to this villa, I sit there and I go, how can I bring some of Mexico back home and start to develop? And I think that I really have transformed my own I haven't transformed my backyard into Mexico by any means, but my mindset is, how do I get to that place? Because I want to be happy all the time. I don't want to be, oh my God, life is stressful, and oh, I can't wait to get back to Mexico again, although it's fun and a great place to be. I want to feel that when I'm home too. So that's really a goal, is, okay, yes, we can get on this retreat and get away from the world, but how can we take some of that back home with us so that we can minimize stress in our regular everyday life? So
And
I would
it's so
love to
important.
open that up. And it's a small group. There's only 14 beds. So it's not a 200, 2000, person retreat. So it can be very connected, very individualized. So there's not a whole lot of spaces. So jump on it. We do have some spots left. So
I love that. I love that. And thank you so much for just sharing your wisdom with us, for being here with us today. And we cannot wait to see you on that retreat. So thank you so much for your time today.
Thank you. Take care, Lori.